sometimes he has this thing he does when he's sleeping, and it looks like he's choking, and then wakes up and then starts snoring again.
Hey, where's the oxygen? I need to breathe. And so your blood pressure goes up, your heart rate can go up, you will have poor sleep because you're not breathing.
Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Dr. Khan, is snoring ever dangerous?
It can be.
No, it's dangerous for your wife.
And part of your own health then, right? She's going to be mad.
Exactly. But in practical scientific terms, is snoring dangerous?
So when you talk to your doctor about it, yes.
Okay.
And the reason I say that is that a lot of times it can be a sign of something called sleep apnea.
What is that?
So sleep apnea means, or that ending, the P-N-E-A, is, I believe, I want to say Latin or Greek, right? Term for breathing. And if you have an A in front of it, that means you're not breathing. So sleep, not breathing. So it's a condition where you're not breathing at nighttime when you sleep.
Okay. And how does that affect patients? And before you answer, I want to tell you a story of a patient we have in the clinic who came in. This was about a year ago with high blood pressure. Now he's also dealing with obesity. His body mass index was 35. And his blood pressure was in the 150s to 100. And so this is despite him taking amlodipine, which he had been receiving from another doctor before he came to see us. And so we did the routine, test, and his wife was there. And his wife, along during the visit, asked me, Doc, sometimes he has this thing he does when he's sleeping, and it looks like he's choking, and then wakes up and then starts snoring again.
Yeah, well, she was describing sleep apnea, the perfect textbook picture for that,
Thank God for women.
Yeah.
And being observant.
Exactly.
And so we sent him to do a sleep study. It turns out he had sleep apnea. And once he started using a CPAP machine, his blood pressure came down. We didn't have to give him another pill.
Yeah.
How does that happen?
Yes, great question. And I think a lot of patients picture sleep apnea as maybe a breathing issue at nighttime. So to elaborate a little bit more on that, what exactly is going on, right? And so obstructive sleep apnea occurs a lot of times in relation to also obesity, where the patient ends up developing a lot of fat and weight around their neck area as well.
So like crowding in the...
Great way of putting it, yeah. So we look at it as neck circumference. It could be above 17 inches for men or 16, I believe, for women. And if it's larger than that, then you're at a higher likelihood of having your airway sort of collapse on one another. It's sort of like collapsing of like a balloon, I guess. It doesn't pop, but it just collapses back on itself. Then you can't get air in. And during sleep apnea, what happens is that you have this blockage of air, of oxygen you can't breathe in at night. Because of that now, you're also not breathing out, so your carbon dioxide sort of builds up in the body. And then this leads to something we call sympathetic activation. It fires up your body because your body is sort of like, hey, where's the oxygen? I need to breathe. And so your blood pressure goes up, your heart rate can go up, you will have poor sleep because you're not breathing. And then you yourself at some point will wake up. That's your body forcing you to take a breath in. And that's when you go, and you wake up yourself or your partner next to you, So now you have poor sleep affecting your blood pressure, your sympathetic nervous system. And then over time, if this goes undiagnosed, you're affecting the kidneys, the pulmonary arteries, and all the vasculature in there. You're affecting your mental health because your brain is starving of oxygen. So now your memory is affected. You're not as quick as you were. You're feeling fogginess. A lot of times patients describe it as. You're sleepy and tired all the time. You sit. It's afternoon time. You had a lunch. You sit down to go back to work, and you just end up sleeping. And so these are all common signs that we see in someone with sleep apnea. And it's sort of all stemming from the fact that during nighttime for 7 hours or more, your body's starving for oxygen. And then this disease progressing over years and decades. Because again, this is one of those things that a lot of people can ignore because they're sleeping. They may not, really feel it, or they may not feel the impact and the implication of sleep apnea on the body. And so it sort of gets put off to the background, but over time can lead to severe and worsening disease until one day you unfortunately may not wake up.
And I think one of the problems with sleep apnea is that it is something that happens when people are asleep. So you need a witness
There you go. Yep.
to watch A, the snoring, and B, the choking sensation when someone is sleeping. Because I do realize that when we do a screen, when I ask the questions to the patients, sometimes I feel a little silly asking somebody who lives by themselves, do you snore at night?
Yeah.
And sometimes the patient is like,
They'll say, I don't know.
I don't know.
Yeah. I'm like, that's fair. That's fair. That makes sense. The maths.
Exactly.
Yeah. Yeah.
So we need more witnesses. So I think everybody needs at least a recording of their sleep.
There you go.
For the longest time, I told my kids I did not snore at night until they recorded me sleeping, and it was not pretty. So now another thing that's very important to this point we're just talking about is that 30% of adults actually have sleep apnea. That's a staggering number.
Yeah, and I imagine that number is probably gonna get worse because of the rates of obesity and how fast they're going up, and that directly influences sleep apnea as well. And so it's one of those things where, again, we would address at your physical or at one of your appointments, where the next steps, if you are someone who feels like they're snoring or your wife or partner complains, you're feeling tired all the time, you feel like you're foggy or you can't recall, brain's not working right, If you're having some of these symptoms, then it's very worthwhile to get a sleep study done.
So tell me, Dr. Ken, why is this dangerous? What does the science say in terms of what risks does sleep apnea encompass for the patient's health?
Good question. So let's break this down. So now you went to sleep, you're having these long pauses of breathing, your oxygen is tanking, it's on the lower side, seen in the 50s and in the 60s, where it normally should be in the 90s, At the same time, also you're building up carbon dioxide in the body too, which is a acid for the body. So now you're going to be seeing things like your blood pressure is going up. You're going to start having poor sleep, so you're chronically tired and fatigued. You're falling asleep during the daytime. You're snoring a lot. You might be overweight. You might have some comorbid conditions like the weight or diabetes, prediabetes, blood pressure issues. Even things like AFib, atrial fibrillation, is a very common presentation of sleep apnea. Atrial fibrillation is a arrhythmia where your heart is beating very, 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 very fast, but it's sort of fluttering. It's not really beating. It's not really pumping, And this, again, is a whole different problem, but sleep apnea directly leads to that, Along with things like your mental health, your mood. You're feeling tired all the time. Your mood's not going to be the best. You're not going to be the most productive. So again, this is one of those diseases that affects a variety of different parts of your life.
So just to summarize, sleep apnea can lead to heart disease.
Yes.
You mentioned, can lead to high blood pressure, diabetes, things like pulmonary hypertension. There have been some reports.
Yeah, absolutely.
Depression, you just mentioned. So it can affect
Mental health,
everything and your mental health.
Yeah.
All right. So now this brings us to the part of the story where we talk about physician allyship. How can we physicians help patients, A, detect sleep apnea, and B, treat it? Because as you very well know, we take this very seriously in the clinic. We run this questionnaire on all patients during the annual physicals and new patients called the Stop Bang questionnaire. I love that name. Stop Bang questionnaire to detect who has sleep apnea and who hasn't, so we can address it appropriately. Can you speak to that?
Absolutely. So we go through a series of questions. These questions are going to be focused around your sleep habits, what's going on in the sleep. Are you snoring? You have a witness or not? We're looking at, again, your neck circumference. There's also something called the Mallampati score, which when we look inside of your mouth, and I can't see your uvula back there, that tells me it's very crowded in there, so the chances of it closing off is a lot higher than someone where I can see everything in the back of the throat, right? So there's physical exam components of this, and then there's also the symptoms that you might be presenting with that we're going to go through together. And based on what we see, along with a lot of times people with sleep apnea may a lot of times be overweight. We'll already may have high blood pressure. So those are clues that help us sort of, hey, maybe this blood pressure may not be genetic. It might be just coming from the sleep apnea. Yeah. We sort of evaluate the patient, and if it's something that we're concerned for, we will absolutely test you for that, because it has serious connotations if you don't treat it, you know.
And one of the wonderful things nowadays is that, you know, a lot of patients, the parents didn't want to go spend the night in the sleep center.
Right.
And spend all night there hooked up to machines and all of that. Now, you have a lot of home sleeping testing devices that we provide to the patient.
Exactly.
And you get it and you do it at home in the comfort of your own bed.
Exactly.
And we interpret the
results.
results.
And that's a great resource. You know, it's amazing that you guys, we offer that here as well, because it, like you said, one of the complaints for this testing, and a lot of times people didn't do it for that reason, was that they had to go out of their way to a facility that might be an hour away, sleep in a bed with strangers watching you, cameras and wires and uncomfortable bed, and you just don't want to do it. It's like the colonoscopy that no one wants to do, right? And so now, the home option takes away all of that. You can do it at the comfort of your own house, but it will give you valuable information on what is going on at night. And if you do test positive, then our next steps are going to be exactly. Is it something that we can try to manage without severe interventions, or CPAPs? Or can we lose weight in X amount of time and that improves the symptoms? Fantastic.
And that's where technology really plays a huge role, because we talked about technology, technological innovation with the home sleep study, but there's also, let's say, medical advancement in the treatment.
Yes.
You just mentioned treatment first, probably weight loss, and then we have a CPAP.
Then we have the CPAP,
which is the traditional.
Yeah, exactly. So say if you scored on you have sleep apnea, but it's mild, then sure, some interventions like weight loss, getting in shape, correcting those things might take care of it. If you're in the more moderate to higher ranges, then perhaps a CPAP while you work on the weight would be a great option, because what's a CPAP? Let's also sort of address that, because a lot of people have heard this, but they don't know exactly what it does. So we mentioned here that in sleep apnea, what happens is that your throat sort of collapses, and now you can't pass air through it. A CPAP machine, what that stands for is continuous positive airway pressure. And what that does is it sort of blows open the throat, so it prevents it from
keeps the door open.
Keeps the door open, exactly, through air
sleep.
pressure, exactly. Now, it's something that takes adjusting to, right? It's for someone who's never slept with sort of a mask on their face, it can be uncomfortable, and that's another reason why a lot of times patients sort of shy away from using it, right? Because of just the comfortability factor. But even on that note, I'd want to comment that nowadays we have far more different type of face masks. We have nasal masks, and they're made from different materials where they're a lot more comfortable than the options you used to have in the past. So for patients who need a CPAP, might need that machine. And then, like you were mentioning, with advancement in technology, we also now have a implantable device that works on muscle tone and helps keep the airway open. And so,
last but not least, we've got tirzepatide, which was approved for treatment of sleep apnea.
Yes. Great point. With the advent of this, the obesity epidemic that we've been dealing with, and a lot of the weight loss medications that are on the market, we have now also found that some of these medications really help with sleep apnea, because the weight is a direct correlate to severity of your sleep apnea. So if you lose the weight, the sleep apnea should improve.
And what I found even more interesting is that Zepbound, which tirzepatide, was approved for, actually studies show that it improved outcomes in sleep apnea or treated sleep apnea independent of obesity. And so now it has an indication for treatment of sleep apnea in people with sleep apnea and who are also obese. And that is where we find our role as patient allies even more important, because now when the insurance company says, nope, we're not paying for Zepbound for obesity, we do a prior authorization for treatment of
I'm right
sleep
there with
apnea.
you.
Fantastic.
Absolutely, because as soon as I found out that was FDA approved for sleep apnea, because again, a lot of patients have not just one issue; it's comorbid.
It's comorbid.
So we joke around with the patient. We're like, we found a loophole for you.
Yes.
We're gonna get you the weight loss medication, but it's gonna help you with multiple different things: the weight, the diabetes, the sleep apnea, the blood pressure. These medications also show that they're really good for the heart and people who have certain heart issues. Great way to treat using those medications as well.
So if they build a 10-foot wall, we find a 12-foot ladder.
There you go.
Awesome. That's how you become a patient's ally.
I love it.
All right, Dr. Kant, so just to wrap up, take-home messages for our audience. So number one, they have to report loud snoring. If you do not know it, get someone to record you
There you
or
go.
ask a partner.
Yeah.
Number two, get tested. If your stub-band questionnaire shows that you are at risk or your Mallampati score is high, as you mentioned, 3 or 4, get tested for sleep apnea. And last but not least, use your CPAP consistently, lose weight if you need to, or get prescribed tirzepatide for treatment of sleep apnea if your insurance pays for it.
There you go.
All right, fantastic. See you next episode.
Absolutely.
This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.